Fake, false, lie. Over the course of the COVID-19 outbreak, China's response has been bombarded with a Western media narrative of a Chinese cover-up.
如果我们要是想刻意去隐瞒的话，我们就不会公布这些订正的这个数据。
这个它只有提交的功能，没有删去或更改的功能。
China may have deliberately
Many Western media outlets, along with politicians, accuse China of lying to the world about the nature of the coronavirus and that it did little to stop its spread.
Instead, new evidence shows that China lied.
Foreign Ministry spokesperson Hua Chunying tweeted, "What a playbook. Have a look," pointing out a GOP memo urging an anti-China assault over coronavirus.
Is that the White House is now actively considering a range of potent options to further punish China and to cripple it economically. However, China is not Iraq.
Western media unlocked. Coverup reports.
世界卫生组织17号表示，中国武汉订正新冠肺炎确诊病例数。
武汉是本着对历史负责、对人民负责，及时订正新冠肺炎确诊病例数。
On April 17th, China raised its COVID-19 fatality numbers and confirmed cases.
In
the early stage of the outbreak, the healthcare system was overwhelmed, so there could be some delays, omissions, and false positives in reporting. When we checked the number of deaths, some may have been repeatedly counted and had to be corrected. There are delays in reporting fatalities, and some were not counted as COVID-19 cases. But the patients died of health complications related to the novel coronavirus, so revisions are necessary.
However, the revision did not stem the accusations from the Western media, turning a blind eye to how China managed to bring down the death rate. They continued to cite unidentified sources and persist in an outdated ideological bias to discredit China.
What do we know about this intelligence report that's been submitted that we know the White House has had for a few days now?
这个病确诊为新冠肺。
The case will be reported within 2 hours. We will notify the Public Health Department and they will enter it into the system. We can only enter new cases into the system and the data cannot be deleted or altered once they have been entered.
28号，中国大陆8个省份报告有新增非典型肺炎临床诊断病例。
Especially after SARS in 2003, we've established a direct network reporting system for infectious diseases, which emphasizes the responsibility of the first contact doctor. The system of direct network reporting is designed in such a way as to minimize external and unnecessary intervention and interference. In order to ensure that all the information of infectious diseases is reported as soon as possible. The team at China CDC are professionals, and they are most sensitive to the information about infectious diseases. The first thing they came up with was to find the pathogen and figure out what's going on.
Collecting and reporting reliable data has been an issue faced by countries around the world. Reuters reported the daily tally of New York City residents who died at home with coronavirus-like symptoms exploded from 45 on March 20th to 241 on April 5th, suggesting the city may be significantly undercounting COVID-19 deaths. Japan has reported relatively few cases because it limits its coronavirus testing. The UK and France used to exclude people that died in nursing homes from its death toll in their daily counts. But none of these actions has been described as being a cover-up in Western media reports.
As an outbreak happens, especially if systems are overwhelmed, I would anticipate that many countries are going to be in a similar situation. They will have to go back and review records.
Contrary to what many Western media outlets portray, residents in Wuhan find the data from the China CDC trustworthy.
I don't think they concealed the extent about the epidemic. Families would definitely speak out or condemn the government.
The government measures have been carried out in an orderly manner. The city couldn't have reopened based on fake numbers. From what I've heard from my family and friends, the numbers are solid. I know some people who were infected with the virus and they were treated in the hospital.
Why does the city with the first reported case of coronavirus have a significantly lower mortality rate compared to other hard-hit cities and even some countries with sufficient medical systems?
In the early stage, the mortality rate in Wuhan was rather high. We took measures, including the construction of the temporary treatment centers. It greatly reduced the mortality rate. Mild cases are admitted to the temporary treatment centers and moderate and critical cases to designated hospitals. This puts the transmission chain under control. In the temporary treatment centers, if the patient becomes critical, they will be transferred to a designated hospital in time. I don't think other countries have such a mechanism. They are now doing what we did in the beginning. The patient stays at home, but he doesn't know whether he's getting worse. And he also knows that if he gets worse, there's no medical resources for him. So the mortality rate is high.
我省援鄂抗疫医疗队第一批队员从石家庄出征。
今天早上6点40分，我省第4批援鄂医疗队43名医护人员抵达武昌站。
安徽第2批援鄂医疗队的100名医护人员到达武汉。
Since the outbreak, over 42,000 medical staff from across China had come to aid Hubei province, and over 60 hospitals in Wuhan had been adapted to treat the infectious disease. Severe cases receive free treatment.
China was facing a brand new situation and the number of COVID-19 cases skyrocketed. While for other countries it provided experience to be learned from, but they were still not ready and the healthcare systems were overwhelmed.
Those government figures don't appear to stack up.
The fight to control the narrative started as COVID-19 broke out.
There's been a lot of criticism, a lot of questioning regarding China's figures, people suggesting that they've potentially been underreported. I'm not sure if it's come in response to that.
And has only become nastier with U.S. officials spreading misinformation.
U.S. intelligence officials tell CNN they are investigating another possible source, suggesting the virus may not have originated naturally as China has advertised.
The lack of a meaningful response in the U.S., coupled with its pivoting towards the blame game, has seen the coronavirus killing tens of thousands of people in the country.
The U.S. has the most COVID-19 cases and the most deaths. It's no accident. Trump had ample warning of the virus coming from China and actually from other places in late January, both from the intelligence community and from his internal advisors, people like Dr. Peter Navarro and Matt Pottinger. They both wrote memos to Trump saying you should do something about this. Trump actually was annoyed by the memo that he got from Navarro. He said you should have never put this in writing because it's forecast tens of thousands of deaths, actually more than that.
As the pandemic went from bad to worse, President Trump and his congressional and media allies began a massive damage control media blitz. The strategy? First blamed the WHO and then blamed China. But when the crisis first emerged, President Trump praised China for what it had done.
China's working very hard. Late last night, I had a very good talk with President Xi, and we talked mostly about the coronavirus.
Well, I think China is very, professionally run in the sense that they have everything under control.
Well, we're working on it very closely. I spoke to President Xi 2 days ago. They're working on it very professionally.
And do you see the data China has been sharing with the United States has been helpful?
I think it has been helpful. We've been working very much with China.
Now, with Americans dying and re-election prospects threatened, President Trump, China hawks in the administration, and conservative news organizations have found scapegoating China as the best way to salvage an election win. As with many Trump tactics in the past, he seeks to divide and spread disunity.
And there is significant evidence that this came from the laboratory. Those statements can both be true.
You could say that he's the American version of a wolf warrior.
U.S. Deputy National Security Advisor Matthew Pottinger, who spoke on China's May 4th movement, also said Beijing's efforts to punish critics like the doctors who sounded early warnings over the coronavirus outbreak would eventually backfire.
He's a Mandarin speaker and was a reporter for the Wall Street Journal based in Hong Kong.
If you ask me, the author of Death by China and the Coming China Wars, whether I trust China, I would simply say the American people no longer trust China.
There's Harvard-trained economist Peter Navarro, director of Trade and Manufacturing Policy. He's the author of a book called Death by China, and he blames China for all U.S. economic woes. I'd say they're virulently anti-China. Trump never faced an adversary like this virus. In point of fact, except for diversion and deception, his toolkit, his bag of tricks, was useless. You either reach out to the experts at home and abroad to confront the enemy, or you take the coward's path and find a scapegoat to demonize, and you make that scapegoat the enemy.
Are you suggesting that maybe you have some evidence that this was not a naturally occurring virus?
You know, look, you know every theory. You had the theory from the lab, you had the theory from many different, the bats and the type of bat. There's a lot of theories. But yeah, we have people looking at it very, very strongly.
Your Office of the DNI says the consensus, the scientific consensus, was not man-made or genetically modified.
That's right. I agree with that. Yeah, I've seen their analysis. I've seen the summary that you saw that was released publicly. I have no reason to doubt that that is accurate at this point.
Okay, so just to be clear, you do not think it was man-made or genetically modified?
I've seen what the intelligence community has said. I have no reason to believe that they've got it wrong.
America is now a tribal society, divided by belief and by ideology. Liberals have CNN and MSNBC. Conservatives have Fox. But people tend to seek out information from their tribe. They don't want to be confused by facts oftentimes. They just want information, and sometimes misinformation, that reflects the beliefs of their tribe.
Serving as a political tool on some occasions, Western media outlets have amplified the voices of politicians and conveniently overlooked the epidemiological science when it comes to China. They have perpetuated the myth that China knew the outbreak was serious, implying a systematic failure of the government response.
If we want to deliberately conceal the numbers, we would not have published the revised data. On the contrary, we publicize the revised data to the society and the world. I think some people say that we have more cases concealed in China. We require that all the second-level or higher hospitals set up fever clinics. You can't stop patients going to the fever clinics. The numbers cannot be falsified. For what we see now, the numbers are in the normal range.
Every country is fighting the novel disease differently. The Chinese way may not be perfect, but discrediting and scapegoating China does nothing but weaken the global effort. It prevents people from seeing its relevance and values in the crisis.
The reason why China has achieved the initial victory in combating the epidemic has depended on the implementation of the government. For such large-scale infectious diseases, medical care quality is not the most important thing. We are rarely doubted by medical staff in Western countries because they know that they don't have such implementation of a national-wide system like what we have in China. As soon as we come up with a good measure, people all support it. We have different cultural and social structures, so we have different ways to combat the outbreak.
In fact, we have provincial and municipal CDCs in China. The task of these local CDCs is to verify the information and filter out unnecessary information to ensure that accuracy of the reported information. So here may still be a problem of balancing timeliness and accuracy. We are now thinking about how to improve the sensitivity to such public health emergency.
I think there are some good signs, even despite all the back and forth by wolf warriors on both sides. U.S., Chinese, and other nationals are working together to end this virus crisis by developing cures, vaccines. On the negative side, I believe that there's too much saber rattling and that we need to get back to talking to each other and to finding those areas where our national interests overlap. Plenty of problems to address in the world, and we can address them together.